Hey everybody, and welcome back to another video. Today we're going to be talking about a really interesting research letter that was published in JAMA, the Journal of the American Medical Association, looking at persistent symptoms in patients after acute COVID-19. So this is something I've kind of been wondering about. I think probably a lot of people have is, how long may symptoms last even after you're out of the acute phase of infection? Are there residual symptoms that stick around? And this research this research paper sought to start to kind of answer this. So what did they do? Well, this is actually out of Italy. And this group in Italy actually has a post-acute, meaning after the acute phase of the disease, outpatient service for their COVID-19 patients. So essentially, patients who had COVID-19 can go to this outpatient clinic to get like post-COVID-19 care. So to get into this clinic, they have to meet the WHO criteria for discontinuing quarantine. And those patients are the patients who are included in the study. So this means no fever for 3 days, improvement, so not resolution, improvement of symptoms, and 2 negative PCRs for SARS-CoV-2 at least 24 hours apart, so greater than or equal to 24 hours apart. And these are the patients that can go to this post-acute outpatient service, and thus they're the patients included in this study. So what exactly did they do? Well, they looked at patients from April 21st until May 29th at this clinic, which equated to 143 patients. And they talked to these patients and found out what symptoms they were still having. And here we have tables and a graph that we're going to go through to look at that. The first part of this table, though, is just demographics. So it's what these patients looked like. So their average age was 56.5 years old with a standard deviation of 14.6 years. What does that mean? Let's just draw it out quick. So standard deviation looks at kind of a normal spread curve, right? And you have this main group of patients, and one standard deviation in either direction statistically means that 68% of patients will fall within one standard deviation. So 68% of the patients in the study were between 56 minus 14, so 42 years old, and 56 plus 14, or 70 years old. So 68% of patients were 42 to 70 years old. All right, and that's what this one standard deviation means. About half were female, half were male. This just talks about vaccination status. Here's comorbidities. So you can see that, patients in this group did have comorbidities: heart disease, 5%, atrial fibrillation, heart failure, stroke, hypertension, diabetes, kidney failure, thyroid disease, COPD, active cancer, and immune disorders. So there were comorbidities within this population that followed up. Smokers versus non-smokers. Most of them were non-smokers. Some were former smokers, and a few were smokers. 44%, 45%, 10%. All right. And then active COVID characteristics. This is during the acute phase. So this is while these patients actually had COVID. 72, so most of them, a majority of them, did have pneumonia. 12% of them had to be in the intensive care unit. 53% of them had to have oxygen. And then 5% of them were mechanically ventilated in the intensive care unit. So this kind of shows you how sick these patients were in this population. Most of them had pneumonia. The majority of them had to have oxygen therapy, and 13% actually had to be in the intensive care unit, with 5% needing mechanical ventilation. Here they just talk about the pharmacologic treatments that were given. You could see that most of the patients, 71%, had an antiviral given. 73% were treated with hydroxychloroquine, 41% were treated with azithromycin, and 30% were treated with tocilizumab. And we talk about all these different therapies. Go to the pinned comment underneath the video, and you can scroll through the different categories we have down there, of which we have antivirals, hydroxychloroquine, tocilizumab, all those things. Length of stay in the hospital. So these patients on average stayed 13.5 days. And again, we have 9.7 as the standard deviation, which means that 68% of the patients were admitted for between 4 days and 22 days, 68%. Now we have follow-up characteristics. I think this is really important. So how far out were these patients that came to this clinic, right? And this is kind of where we start with our post-acute COVID-19 follow-up data. So days since symptom onset, excuse me, were 60 days. So that is the average number of days since symptom onset. So these weren't patients who had symptoms 15 days ago. This was 60 days. That's about 2 months after symptoms started, they followed up. And many of them were even closer to 3 months. Days since discharge, most of them were at least 36 days since discharge. So about a month, greater than a month since discharge. And of those patients, only 12% had no symptoms. So only 12% at the time they followed up had no symptoms. Symptoms SX. Which means the majority of them actually had greater than 3 symptoms. So 55% had greater than 3 symptoms at the time of follow-up at this outpatient clinic. 44% of which endorsed a worsened quality of life because of those symptoms. So that's a pretty impressive number, unfortunately so. 55% of the patients who were, on average 60 days since their symptoms started, still had greater than or equal to 3 symptoms, of which 44% had a, worsened quality of life. So what kind of symptoms did they endorse? That's what this graph is showing us. So this graph looks at patients with symptoms, the percent of patients with that symptom versus the symptoms itself. And this is the acute COVID phase. So this is while the patients actually had COVID, and then we have the post COVID-19 follow-up phase. And you can see that the majority of patients who endorse symptoms, so it looks like about 55% of patients had fatigue. That was followed by, about 45% of patients who had dyspnea, which is shortness of breath. So fatigue and shortness of breath, 2 symptoms that can, be life-altering, occurred in almost more than half of these patients after they already healed from COVID-19. You can see now we kind of have what symptoms they had in order of highest prevalence. So joint pain, chest pain, cough, anosmia, which is lack of smell, Sicca syndrome or dryness, rhinitis, which is that inflammation in the nose, red eyes, dysgeusia, which is change in taste, triangle for change in taste, headaches, sputum production, lack of appetite, sore throat, vertigo, which is that spinning sensation or dizziness, myalgias, which are muscle aches, and diarrhea. So this is a fairly large number of symptoms here, and you can see that patients, even after they have healed from COVID, are endorsing a bunch of different symptoms. So I think this is important to note. I think 2 things here. Number one, this tells us that even after we've healed from COVID, this disease process leaves us for a number of weeks with persistent symptoms that can be life-altering. I think the other thing to notice, though, is that this study is not forever. These symptoms may resolve, but we don't know in what time period they resolve. So that's something that will, come with more time. But I think the big things to take home from this are that 87.4% of these patients reported at least greater than or equal to 1 symptom that was persistent after healing from COVID-19. All right. Well, thank you all for watching. Let us know what thoughts, questions, concerns you have down below. Feel free to subscribe to follow along. Check out our pinned comment for a bunch of additional videos, and we will see you all next time.